If
Hello everyone, Andy and I are excited to be attending and presenting at our first Canadian Alliance to End Homelessness conference. The program looks fantastic and I'm really keen to learn more about homelessness statistics in Canada in this session. I work across two organisations, Launch Housing and the Centre for Urban Transitions at Swinburne University of Technology. And Andy is the Deputy Director of the Centre for Urban Transitions at Swinburne University of Technology and is also the Uhuru Research Centre Director. Our presentation on homelessness risk and prevention today is based on work across a couple of publications and projects. And we'd like to acknowledge our colleagues who aren't presenting today, Maggie Reynolds, also from the Centre for Urban Transitions, and Jackie DeVries from the University of Tasmania. We are presenting today from Melbourne or Naarm on the lands of the Wurundjeri people of the Kulin Nation. We pay our respects to these traditional owners and their elders, past, present and emerging, and acknowledge that sovereignty was never ceded. We also pay our respects to First Nations people around the world, especially those in Canada where this conference is taking place. So why estimate the population at risk of homelessness? We can't continue the focus on business as usual and crisis-focused responses if we want to get serious about ending homelessness. Ending homelessness requires not just addressing it when it occurs, but stopping people from ever becoming homeless in the first place. In order to successfully prevent homelessness, though, we first need to know who is at risk and why. Knowing how many people experience homelessness has been critical in elevating homelessness as a policy issue and galvanising action. So knowing how many are at risk, their profile and where they are can be used to shape preventative policy and advocate for prevention in a similar way. It can also provide a metric to monitor the effectiveness of primary prevention initiatives and tailor their focus and implementation over time. But the first step is to determine who is at risk. We already have a pretty good handle in Australia, I think, on who is at imminent risk of homelessness, and that would include people with an eviction notice, people exiting institutions, for example, prisons, mental health facilities, young people leaving state care, and women and children escaping family violence. But these groups are really imminently about to be homeless and are the focus of secondary prevention efforts. To focus on primary prevention, we need to understand the broader population at risk of homelessness. We've drawn on a definition of homelessness risk that was recently developed. And it was developed by looking at the various causes of homelessness and the common mechanisms through which they act or bring about homelessness. So people experiencing two or more of these mechanisms at the same time are deemed to be at risk of homelessness. And these 5 mechanisms include having low or low unstable income. And in Australia, that's the bottom 20% of the equivalised household income distribution, being vulnerable to discrimination in the housing and labour market that can be due to age, Indigenous status, being LGBTIQ from a non-English speaking background, needing support to access or maintain a living situation. That one's really about needing support with your housing because of significant ill health, disability, mental health issues, or problematic use of alcohol and other drugs. Having limited social resources and supports. So that might be having a small or non-existent social network, or a network that doesn't provide you with significant emotional support or financial resources, material support when you need it, such as childcare, finances, a place to stay. And a tight housing market is the 5th mechanism, and we focus specifically on people experiencing rental stress. So people need to have 2 of these 5 things at once. The risk measure is also constructed so that each of these 5 mechanisms are distinct. So one attribute or experience only qualifies a person for one category. We can't double count them. So for example, while someone might be likely to experience discrimination because they have a disability, disability is only included in the support to access or maintain a living situation category, not in the vulnerable discrimination category. We also restricted this definition to include only those renting privately, so no owner-occupiers. And we also accounted for household composition in the way we applied it, using the argument that having other adults in the household who are not at risk would provide a buffer against transition into homelessness. And from here, once you're at risk, additional misfortunes, experiences, and losses can then mean that people move from being at risk into experiencing actual homelessness. So at the national level, we estimate that at least 8% of people aged 15 years and over, or about 1.5 million people, are at risk of homelessness in Australia, all of whom reside in rental housing. And to put these large numbers in context, I mean, over the 8 years between July 2011 and 2019, 1.2 million people in Australia received assistance from homelessness services. And estimates from our General Social Survey suggest that 11% of the population aged 15 years and over have a lifetime experience of homelessness. So 8% of the population isn't really out of the question. Compared to the national population, those at risk are more likely to be female, Indigenous, and be living in a lone person or lone parent household. They're more likely to identify as lesbian, gay, or bisexual, to report fair or poor health. They're more likely to be low income, unemployed, or outside the labour force, and in receipt of income support payments. Those at risk have lower levels of educational attainment. They're more likely to report difficulty paying bills and rent on time, and they're more likely to experience rental stress and a range of indicators of material deprivation, such as skipping meals and being unable to heat their home. So how do we come up with this number and profile? I will hand you over to Andy now.
Thank you, Deb. So as you can see from Deb's list of risk factors, there's quite a few of them, and obtaining detailed data on so many risk factors can be very challenging. And there's typically a trade-off. If detailed data exists, it is typically through some kind of survey data, which might have limited observations, so a limited number of people. So this may not be a problem if you're trying to estimate a national level statistic or for larger regions, but it will be a problem for finer statistics or statistics at finer level that also are robust. Where large geographic data is available or does exist, there's typically much less information and much less detail in the information. And in our case in Australia, there's also an issue of actually being able to identify or exclude overlapping categories, such as Deb talked about. So in Australia, a typical survey is the Household Income and Labour Dynamics in Australia, or HILDA for short, which provides detailed insight on lots and lots of socioeconomic and labour market characteristics. It is nationally representative. We can identify these risk factors that they've listed, and we can produce national and state level estimates of the population at risk. However, the sample size below state levels begin to become very small, and we can no longer directly and in a precise manner measure the number or the share of people with a particular attribute. In our case, with people at risk of homelessness. HILDA has been running for 23 years. It has great coverage of data, but in order to produce the small area estimates, we need to combine it with data that also has very detailed spatial information, such as the census or some other administrative data source that has great geographic coverage. So small area estimate techniques combine information from detailed survey data with other data sources that have much larger sample sizes and geographic coverage. And in the research soon to be published, we use this method to calculate the population at risk in what are called SA2s and SA3s in Australia. And SA2 is roughly the size of a suburb, and SA3 is a collection of suburbs and sometimes small towns. There are a number of different ways that we can do this. The two approaches that we've based on are specifying a model that explains the risk of homelessness in the survey data. So this is the data source that with a limited spatial coverage, or on the slide here, this is illustrated with the yellow circles and leading to a risk of homelessness. And then combining that with data from a secondary data source, such as the census, which has lots and lots of detailed information at fine spatial levels, but doesn't actually have enough information to estimate the at risk of homelessness. So the exercise really consists in one of finding this partial overlap so that you can transfer information from one set of data to another set of data. Our approach, we take two approaches, I've said. We have what is called a unit level approach and an area level approach. In the unit level approach, we transfer the coefficients from our regression model to the census data. So imagine in the diagram I showed on the previous slide, we had these sort of 4 yellow boxes leading up to a measure of risk. Now imagine we take those 4 variables and say, well, hey, in the census, we can find now the number of people in each of these areas that has those 4 characteristics. And we can sum them up, and there we have the number of people with those 4 characteristics, but without the actual observation on homelessness risk. And then we can calculate out coefficient times number of people, and we can work out what the risk of homelessness is for fine spatial scales. The area level model, we begin by calculating the imprecise percentage of people at risk that we can get from HILDA. And we then estimate how imprecise this measure is. So we'll be more imprecise in some areas than in other areas. And we use both of these pieces of information and combine it again with census data that has detailed observation on the percentage of people with different types of attributes at each of the spatial scales. And again, we use an econometric technique to combine these two and produce our area level risk. Now, for the area level risk, it was only feasible really to do this at SA3 level, because at SA2 level, the measure of variability or the imprecision becomes so large that the estimates became rather meaningless. Now, using these techniques, we can produce maps like this. So this is not an actual map of the number of people or the risk of homelessness, but it's a map of the actual experience of homelessness in Australia from a previous study published by Ahuri and involving Deb, who is also presenting it today. But the beauty of this is really that we can map out at very fine spatial scales, what the number of people are with different types of risk characteristics, or with an overall likelihood of being at risk of homelessness. So depending a little bit on what type of data you have, you might be able to use 1 or 2 or more than 2 methods of using this, but it's really a versatile technique for identifying when we haven't got the detailed information from survey data, combining it with additional data sources to produce these new statistics. With that, I'm going to hand you over to Deb, who will talk about how exactly we're going to use this now when we have this information.
Lovely. Thanks, Andy. So in terms of aspatial or national level policies for primary prevention, once you have your results, your national estimates, your profile and your small area estimates, some priority areas in Australia would include our national government playing a coordinating role really with our 2 other levels of government around primary prevention policy. It would also include increasing the levels of income support payments. And in Australia, they're centrally administered and they don't vary between states and territories. So it is a flat rate. It would include increasing the labour market earnings of the lowest paid and increasing funding for affordable housing. But small area estimates are great in that they allow you to target primary prevention policies and interventions spatially to where they're needed most. So primary prevention initiatives that could be spatially targeted in Australia include things like increasing the supply of affordable rental housing in areas with more people at risk, targeting the expansion of secondary prevention programs, such as private rental access programs. We have these programs in Australia. They're about brokering access to private rental housing, providing some setup costs and an ongoing rental subsidy for a fixed period of time, and also spatially targeting disability and health services as well. Great. So there are some opportunities for Canada in this work. You can do something similar in Canada. You have both a household panel survey with Lisa, and you have census data, which provides data at the small area level. So you could do something like this. And we'd love to be part of and support any projects that try to do this. And I think really what we've done in Australia from your perspective is a worked example, but similar results in your jurisdiction could provide concrete direction to primary prevention policy, as well as enabling you to geographically target services and interventions. You could also use that data to evaluate and monitor progress on primary prevention for both spatially targeted policies and interventions, but also aspatial ones. So, for example, you could look at the impact of increasing the minimum wage on risk of homelessness and homelessness estimates and how they compare after the intervention. There are some options there. Thank you for your time. If you'd like to have a look at the work we've published so far, we have an article in the European Journal of Homelessness, and we will have a big report funded by Uhuri out at the end of November. And that report uses our small area estimation techniques that we talked about today. So that report will include updated numbers on the population at risk, as well as documenting the geography of homelessness risk in Australia and stepping out sort of in more concrete ways, the implications for primary prevention as well in Australia. So hopefully that will be of interest. Thanks for your time.
Thank you.